All right, a new survey from the New York Fed shows that small businesses do remain nervous about the Affordable Care Act. When asked, a majority of companies expect the law to increase their coverage costs, and 1 in 5 said they were adding either more part-time workers or cutting employees altogether. Joining us now is Avik Roy of the Manhattan Institute, and from the front lines of America's small business community is Madeline Alfano, owner and president of Maria's Italian Kitchen.
Going to our new Pronto, which is our Maria's Italian Kitchen Pronto, which is the fast casual model. So it will limit the number of staff that we need. So rather than having 20 people on staff, we might only need 9 or 10. And that will also help in the overall cost. You'll still get the great food and the great service, but you'll be doing a little of the more of the work yourself. Maybe ordering online before you come in. We're looking at that model where you take your smartphone, you order your food, you walk into the restaurant, it's ready for you, we hand it to you, you sit down and you eat it. And so we're looking at ways of not cutting labor, but being more efficient, and it will take away jobs. I will tell you that moving to technology will help the business model manage labor, so less hours will be needed to have employees in different times. We have to really look at being efficient.
Okay, Avik, let's go to you now, okay, because businesses forever have been complaining about health care costs, and indeed they should be. Health care inflation has been one of the greatest threats to corporate and small business America for the last 20 years. Along comes Obamacare. It's ratcheted up the political dialogue, so now we're really doomed. Weren't we in trouble before? I'm not defending Obamacare or whatever, but weren't we in trouble before? Healthcare was a disaster before.
It was a disaster before, but Obamacare has accelerated the problem. It's made this core problem worse. So now, instead of healthcare costs going up 4, 5, 6% a year, this year it's perhaps going up 10% a year, next year as well. And if you're a small business with really low margins, right, you have to either engage in labor-saving devices or you have to pass those higher costs on to your consumers. So we'll see if a lot of people in that New York Fed survey, 36% of manufacturing businesses and 25% of services businesses said that they were going to increase prices and pass those costs on to their consumers. So maybe that gives inflation a nudge, along with increasing structural employment for this hourly wage labor force.
So we all end up paying at the bottom line.
That's exactly right. You can't hide these costs forever. Eventually, it gets passed down to the consumer and to these workers, of course, who are going to have to deal with lower wage increases and less work overall.
But Avik, okay, here's my point. We talked about obesity yesterday. We're going to actually talk about it later on in the show today. Here's the issue. Rather than complaining about the treatment costs of something, when are business owners and the government and whatever going to say, why is America so sick? Right? Smoking rates have come down, workplace injuries have come way down, and yet the number of people on disability is at an all-time record, sick days, everything else. Why do we need so much health care? Why are we consuming so much more than the next highest nations, at least in terms of cost?
Here's the interesting thing. Actually, if you actually look at the level of sickness or illness or diabetes or obesity or whatever you want to look at in the United States, match that to other countries, that's not the driver of why we spend so much on health care. The driver of why we spend so much on health care is that hospitals and doctors charge much higher prices for the same services, 4 to 5 times. The cost of a hospital day in the United States is about $3,000.
And ask you to take way too many tests and procedures compared to other countries.